Welcome back. You're still tuned into Health Matters on the Medicine Box. I have Dr. Dadina as well as Dr. Parikh with me to answer a lot of questions related to women's health. Well, Dr. Dadina, let's move over to perimenopause. This is basically when women haven't hit menopause, but they start getting the symptoms which probably lead them to it. Give us a sense in terms of what the symptoms are and when should one see a doctor?
So generally, this is a very variable time. It can start for some girls by 35, 38. It can start for some women 42, 45. So it varies from person to person. And perimenopause, which means around the time of menopause or before menopause actually starts. And a lot of symptoms are including mental symptoms, physical symptoms. So some of the women go through a feeling of diffidence, irritability, mood swings. A lot of women go through menstrual disturbances, and you need to counsel them that, look, this is a transition process. Just as when you started menstruating, changes happened, now the other changes are happening because gradually the ovarian function is shutting down. Ovaries are the only organ in the body that shut down while we are still alive. So as the hormonal changes between estrogen and progesterone happen, certain imbalances called vasomotor instability, these things which do affect day-to-day life. It also has a systemic role on the cardiac system, on the bone density, on the digestive system. So it's very important to counsel the women that these changes are occurring and how to handle them. And when you actually reach menopause, whose definition is by not having a period for a period of 1 year. After your period has ceased for 1 year, then you are in menopause. And then some of these symptoms can really magnify. Genitourinary symptoms like severe dryness of the vagina, sexual intercourse becomes very difficult. And a lot of women go through a lot of mental anguish. In fact, sometimes they even say that the divorce rate goes up.
Dr. Parikh, just a related question which Dr. Dadina also mentioned when we were chatting before the show is that do fertility treatments such as egg freezing actually bring menopause on earlier?
So, Ekta, this is a common myth, and it's very important to counsel women, particularly the slightly older ones who are say 34, 35 and coming for egg freezing or even for IVF, that a woman is born with more than 500,000 to 2 million eggs. And these don't suddenly disappear. By the time she's 30, there will be a few 100,000 left. By the time she's 40, there'll be about a few thousand left. So under the normal circumstances, doing IVF, which will only entail bringing about 20 eggs at the most into the trajectory, this does not lead to atresia and this does not cause an early menopause.
Let's move over to menopause. Many people describe it as freedom as well to do whatever you like. But there are some myths related to it. For example, we did get questions in terms of whether we need to actually even do pap smears after you hit menopause. Is that necessary? What are the tests that you need to continue doing post-menopause? And what are you now more susceptible for? For example, cardiac disease.
So the WHO recommends that you continue doing your pap smears, which if they are within the normal range, every 2 years till you reach 50, then it can be every 3 years. And then if 3 come negative following that, you don't have to do it. This is routine. But if there is symptoms of excessive discharge or there are some symptoms that alert you, then it's necessary to do it even if you're 65 or 70. Bone densitometry should be done regularly because a lot of menopausal women do get into osteopenia and osteoporosis, which is basically the bone becoming very brittle and suffer fractures more easily. Vis-a-vis the cardiac protection also. So in blood tests, it's important to do a lipid profile, a sugar profile, and keep also there are a few cancer tumor markers that we do to watch the ovaries and the internal health.
Okay.
So it's important to at least once a year, every woman must have a full checkup done, just so that nothing slips past you.
Okay. Dr. Parikh, supplements, what would you recommend would be supplements that women need to probably take, and how much of it?
So, Ekta, I'm not a firm believer of supplements. If one eats a nutritious meal, a well-balanced diet, there is really no need for supplements. If you are supplementing the vitamin D3 naturally in your body by being out, taking in the sunshine, exposing yourself to the sun, if you are eating a healthy diet, even if you're a vegetarian, if you're consuming the amounts of folic acid, B12, calcium, which comes from all the natural substances, absolutely no need for supplements. There is one supplement, however, which I will say that should be taken, particularly for women in the older age group, and that is an omega-3. Because omega-3 has many health benefits. It looks at the cholesterol, bringing down the cholesterol. It gives and it energizes the cells, and it improves the longevity. So if you were told that there is one supplement you need to take, if you are having a good balanced diet, I would suggest an omega-3. This is very vital for a woman's well-being. Of course, if a woman is deficient in D3, B12, folic acid, even if she's deficient in her thyroid hormones, then supplements are essential. If somebody is anemic, it is important to find out the reason for anemia rather than giving her an iron tablet.
Surprisingly, statistics show that women have depression and anxiety 2x more than men. What can you leave us with in terms of thoughts when it comes to mental health for women across age groups?
I would say that most women have this thing of bearing it. This is my lot, this is what's happening. There are very few women who come and talk about it. And I think these women really need counseling, these people need analysis, and they need to be, their hand needs to be held through this difficult time. A lot of women are even labeled with psychiatric disorders, and people misunderstand that mental health of a woman is very important. So I feel that if a woman has a problem, speaking about it and asking for help is what is most important.
Okay, and Dr. Parikh?
Yeah, the incidence of depression, forgetfulness, feeling lonely starts creeping up as one ages because there's an emptiness syndrome. Everybody's busy with their lives. The children are married. There's not too much people to talk to. So what my motto is for myself personally is to be vulnerable. Be vulnerable and experience certain emotions where you can reach out to your friends, to your immediate family, and don't feel shy. Don't be afraid of expressing your anxiety or your fears, because that is the way one can conquer depression rather than just going to a doctor. Use your friends, use your family, and of course the doctor will guide you through this difficult time.
Okay, all right, Dr. Parikh as well as Dr. Dadina, it's been a pleasure. Thank you very much. We have a whole host of topics in the women's health segment. We could cover a little more, and I'm sure we'll get to more topics as we go on. Thank you very much for joining in and taking the time out.
Thank you for having us.